Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's July 2021 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is a special article on the provision and mission of healthcare requiring trust-based partnerships with patients. It is entitled Trust-Based Partnerships Are Essential and Achievable in Healthcare Service. It is authored by Dr. Leonard Berry from Texas A&M University in College Station, Texas, and colleagues from this institution, from the Henry Ford Health System in Detroit, Michigan, and from Vejle Hospital in Vejle, Denmark. Trust is a cornerstone of any mutually fulfilling, meaningful human relationship into which one willingly and knowingly enters. Berry et al. Discuss the importance of and the need for trust in healthcare services, founded as they are on a particular human relationship, in this case, the patient-provider healthcare professional relationship. Berry et al. Begin their discussion by underscoring that the concept of trust in its totality in this context includes not just the patient's trust and confidence in the competence and expertise of healthcare professionals, but also the hope that a partnership will be achieved with providers, a partnership characterized by the provision of a relational medical care, personalized care, shared decision-making, and a patient-centric focus. Berry et al. Identify 4 interlinked concepts that promote trust-based partnerships with patients in healthcare. The first is empathetic creativity, which reflects the commitment to seek and the ability to adopt innovative approaches in caring for patients, especially when conventional ones prove wanting. The second is discretionary effort, which reflects the voluntary giving of service beyond what is usually expected or minimally required, so as to promote patient care and well-being. The third is seamless service, which represents a ready integration and marshaling of expertise and resources that are attentive to and address the medical issue at hand, both in its immediate as well as far-ranging ramifications. And the fourth is fear mitigation, which represents the commitment and ability to address and alleviate disquietude, emotional distress, and fear, all of which may accompany any illness. Berry et al. Delineate a number of approaches that may be pursued at healthcare systems that promote partnership-based trust, and these include: first, instilling a requisite culture dedicated to patient care, including a culture informed by trust. Second, emphasizing the importance of values and virtues, as well as competence and skills in individuals who are recruited and hired. Third, promoting continuous learning. Fourth, fostering attentiveness to effective and empathetic communication. Fifth, providing readily accessible resources that assist patients. And finally, pursuing evidence-based design of facilities and systems that promote trust. For each of these approaches, as well as for the 4 concepts that promote trust-based partnerships, Berry et al. Provide telling anecdotes and vignettes that illustrate their significance and impact. This special article concludes by broadly outlining, first, the key issues that impair the vitality and the realization of the mission of current healthcare, including the adverse and profound repercussions of clinician burnout. And second, how the true mission of healthcare can be reclaimed and strengthened by attentiveness to such issues. As physicians, providers, and healthcare professionals, we are privileged by the opportunity and responsibility in serving our patients. This privilege granted to us and at individual and leadership levels in healthcare systems, inspires and obligates us to seek what is best for the health and healing of our patients. In this regard, Berry et al. Address and underscore the foundational importance of trust-based partnerships with patients in healthcare systems. Our first highlight this month is an original article that examines trends, regional differences, and disparities in cardiovascular health. It is entitled Geographic Variation in Cardiovascular Health Among American Adults. It is authored by Dr. Vibhu Pacha and colleagues from the University of Alabama at Birmingham in Birmingham, Alabama. Cardiovascular diseases represent the leading cause of mortality in the United States, causing one such death every 36 seconds. Heart disease accounts for 1 in every 4 deaths and imposes well over $200 billion in annual healthcare costs. Temporal changes in cardiovascular risk factors and mortality from cardiovascular diseases are thus of immense importance and timeliness. In the occurrence study, Pacha et al. Analyzed data derived from the 2011 to 2017 behavioral risk factor surveillance system, nationally as well as for specific regions, namely Northeast, Midwest, South, and West. The behavioral risk factor surveillance system is a telephone-conducted, validated, health-related survey of more than 400,000 adults regarding chronic diseases and risk factors. It is supported by the Centers for Disease Control and Prevention and involves all 50 states in the United States. Pacha et al. Assessed cardiovascular health by the Cardiovascular Health Index, the latter reflecting 7 indices, namely blood pressure, serum cholesterol, blood glucose, body mass index, smoking, physical activity, and diet. Cardiovascular health was determined as a continuous variable based on the score derived from these 7 indices, as well as a categorical variable categorized as either ideal, intermediate, or poor. Age-adjusted cardiovascular mortality was assessed using the CDC wide-ranging online data for epidemiologic research. The analysis by Pacha et al. Demonstrates that over the time frame examined, there was a quite modest, clinically insignificant improvement in the cardiovascular health index, with less than 1 in 6 individuals in all geographic regions exhibiting ideal cardiovascular health. While the prevalence of dyslipidemia, coronary heart disease, and smoking all declined, the prevalence of obesity and physical inactivity increased. Geographic differences in the cardiovascular health index and cardiovascular mortality were readily apparent. The southern United States exhibiting the lowest cardiovascular health index and the highest cardiovascular mortality. The southern region also exhibited the highest prevalence of specific cardiovascular risk factors, such as hypertension, diabetes, hypercholesterolemia, obesity, physical inactivity, as well as coronary heart disease and stroke. In their discussion, Pacha et al. Outlined factors that may contribute to observed trends and geographic differences in cardiovascular risk factors and mortality, including, first, increasing prevalence of obesity and physical inactivity. Second, an even reduction in such risk factors as smoking, dyslipidemia, and in coronary heart disease. Third, access to and affordability of healthcare. Fourth, the prevalence of public health interventions. Fifth, socioeconomic factors. And sixth, the effect of race and ethnicity and race-ethnicity associated inequities in healthcare. The study by Pacha et al. Is both important and timely because it underscores at least 3 issues. The first is the relatively low prevalence of ideal cardiovascular health that exists in the United States. The second is the need for renewed emphasis in national initiatives in targeting known risk factors for cardiovascular diseases. And the third is the need for public health policies and initiatives that address regional disparities and inequities in cardiovascular health and mortality. Our second highlight this month is an original article on the post-COVID-19 syndrome that's entitled Post-COVID-19 Syndrome, Long Haul Syndrome, Description of a Multidisciplinary Clinic at the Mayo Clinic and Characteristics of the Initial Patient Cohort. It is authored by Dr. Greg Vanichkachorn and colleagues from Mayo Clinic in Rochester, Minnesota. Vanichkachorn et al. Report the clinical features of the first 100 patients evaluated and managed from June 1st, 2020 to December 31st, 2020 at the COVID-19 Activity Rehabilitation Program at Mayo Clinic. This multidisciplinary program is dedicated to the evaluation and management of patients with chronic symptoms arising after a prior episode of COVID-19. The major presenting symptoms exhibited by this patient population included fatigue, respiratory and neurologic symptoms, disruption in sleep, and impairment in mental acuity and health. These patients presented approximately 3 months after COVID-19, the majority being women with a mean age of 45 years. In this patient population, 75% did not experience COVID-19 severe enough to require hospitalization, and chronic conditions recognized as risk factors for COVID-19 were generally uncommon, with less than 1/4 of the patients exhibiting cardiovascular or respiratory conditions. Functional impairment was relatively common, with more than 80% of patients experiencing difficulties with household chores, work-related tasks, and driving, among other activities. 1/3 were unable to resume their usual work routine and responsibility, and 1/3 were challenged when performing activities of daily living. In discussing their findings, Vanichkachorn et al. Emphasized the following considerations. First, these patients with the post-COVID-19 syndrome differ from those who develop moderate to severe COVID-19 because of their younger age and the relative absence of pre-existing risk factors for COVID-19. Second, because of the relative absence of such predisposing conditions, it is difficult to predict the likelihood of a patient with COVID-19 developing the post-COVID-19 syndrome. Third, results from testing in this population were generally normal or non-diagnostic, findings that argue for a discerning and prudent use of diagnostic testing. The one caveat perhaps is autonomic testing, as 12 such tests were abnormal. Where indicated, referral to neurology and such testing may be considered. Fourth, physical and occupational therapy and brain rehabilitation in select patients may aid in the management of these patients in light of the frequency of functional impairment and impairment in mental acuity, respectively. Fifth, psychosocial support may play a significant role in the recovery of these patients in view of the relative frequency of depression, anxiety, and other symptoms pertaining to mental health. This report by Vanichkachorn et al. Thus affirms the existence of and elucidates the post-COVID-19 long haul syndrome. As made clear by the study of Vanichkachorn et al., this syndrome can be physically, emotionally, and functionally debilitating, and the interplay of physical and emotional ailments may promote its chronicity and intractability. Recognizing and understanding this syndrome and developing integrated programs to effectively treat it are thus critically important. The initiatives and experience of Vanichkachorn and colleagues in the COVID-19 Activity Rehabilitation Program are thus important and timely ones in meeting these objectives. You can access these highlights and editor's choice articles free of charge during the entire month of July. When you visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, you will find links to our social media by clicking the buttons at the top of the home page and at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are available from our website on the home page as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who've made a strong impact to their field of study. You'll find many news stories at our website that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content, such as our Path to Patient Image Quiz, medical images, stamped vignettes on medical sciences, and Art at Mayo Clinic features, as well as articles published online ahead of print. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.